Which organ system is most susceptible to injury due to embolization during CPB? A. Cardiovascular system. B. Renal system. C. Hepatic system. D. Gastrointestinal system. Answer: B. Renal system. Explanation: the renal system is highly sensitive to embolic events, including air bubbles or thrombi that travel through the aorta and block renal arteries. This can lead to acute kidney injury, AKI, which is a common complication after CPB. How does CPB contribute to platelet dysfunction? A. Increased platelet aggregation due to mechanical shear forces. B. Decreased platelet count due to consumption. C. Direct platelet toxicity from heparin. D. Inhibition of platelet aggregation by activated protein C. Answer: A. Increased platelet aggregation due to mechanical shear forces. Explanation: during CPB, platelet activation occurs due to mechanical shear forces in the circuit, leading to aggregation and clot formation. This results in platelet dysfunction, which contributes to bleeding and clotting complications during and after surgery. Which strategy is least likely to reduce the incidence of acute kidney injury, AKI, during CPB? A. Maintaining a mean arterial pressure, MAP, of 65 to 70 mm of mercury. B. Using renal protective strategies like diuretics during surgery. C. Using low-dose dopamine for renal protection. D. Minimizing the duration of aortic cross-clamp time. Answer: C. Using low-dose dopamine for renal protection. Explanation: there is no strong evidence supporting low-dose dopamine for renal protection. The focus should be on maintaining adequate perfusion pressure, MAP greater than 65 mm of mercury, limiting ischemia, and reducing cross-clamp time to reduce the risk of acute kidney injury, AKI. What factor most significantly contributes to cerebral injury during CPB in older adults? A. Hypothermia. B. Atrial fibrillation. C. Pre-existing vascular disease. D. High blood pressure during surgery. Answer: C. Pre-existing vascular disease. Explanation: older adults often have pre-existing vascular disease, atherosclerosis, which increases the risk of cerebral embolism and ischemic events during CPB. These individuals may have a higher burden of carotid artery disease, increasing their stroke risk during surgery. Which of the following is a potential consequence of CPB-induced liver injury? A. Increased bilirubin and liver enzymes. B. Hypoglycemia from reduced hepatic glucose production. C. Increased risk of myocardial infarction. D. Respiratory acidosis due to impaired liver function. Answer: A. Increased bilirubin and liver enzymes. Explanation: liver injury during CPB can lead to increased bilirubin and transaminases due to hepatic ischemia and reperfusion. This is commonly seen in the postoperative period, especially in patients with compromised hepatic function. Which of the following strategies is most effective in reducing oxidative stress during CPB? A. Administration of corticosteroids. B. Use of heparin-coated circuits. C. Antioxidant therapy, e.g., vitamin C and E. D. Use of low-dose diuretics. Answer: C. Antioxidant therapy, e.g., vitamin C and E. Explanation: antioxidant therapy has been shown to reduce oxidative stress during CPB by neutralizing reactive oxygen species, ROS, that are produced as a result of ischemia-reperfusion injury. Vitamin C and E are common antioxidants used for this purpose. What is the primary cause of respiratory failure after CPB in patients with pre-existing lung disease? A. Atelectasis due to prolonged ventilation. B. Systemic inflammatory response syndrome, SIRS. C. Right heart failure and pulmonary edema. D. Direct lung trauma from the CPB circuit. Answer: C. Right heart failure and pulmonary edema. Explanation: patients with pre-existing lung disease are at greater risk for right heart failure and pulmonary edema after CPB. This can be aggravated by reduced pulmonary blood flow and fluid overload during surgery. Which of the following is the most common cause of acute liver dysfunction after CPB? A. Sepsis. B. Drug-induced hepatotoxicity. C. Ischemia-reperfusion injury. D. Excessive heparin use. Answer: C. Ischemia-reperfusion injury. Explanation: the liver is sensitive to ischemia-reperfusion injury during CPB, especially during hypotension and low-flow states. The subsequent reperfusion causes oxidative damage to hepatocytes, leading to elevated liver enzymes and dysfunction. Which factor has the least impact on renal injury during CPB? A. Duration of CPB. B. Use of high-dose vasopressors. C. Preoperative renal function. D. Maintenance of adequate systemic perfusion pressure. Answer: B. Use of high-dose vasopressors. Explanation: while high-dose vasopressors may have cardiovascular benefits, they are not as directly linked to renal injury during CPB as other factors such as duration of CPB, preoperative renal function, and adequate perfusion pressure. Which of the following best describes the mechanism of neurologic injury during CPB? A. Direct mechanical injury from surgical manipulation. B. Reduced cerebral perfusion due to low cardiac output. C. Bacterial infection leading to meningitis. D. Acute elevation in intracranial pressure due to fluid overload. Answer: B. Reduced cerebral perfusion due to low cardiac output. Explanation: reduced cerebral perfusion due to low cardiac output or inadequate blood flow during CPB can lead to cerebral ischemia, causing neurological deficits. This is often exacerbated by microembolism, hypoxia, and hemodynamic instability.